Pulmonary circulation. Pulmonary circulation refers to the movement of blood through the blood vessels in the lungs. It involves the pulmonary artery, which carries deoxygenated blood to the alveoli of the lungs, and the bronchial artery, which supplies oxygenated blood to other structures in the lungs. Pulmonary blood vessels. The pulmonary artery is responsible for transporting deoxygenated blood from the right ventricle to the alveoli of the lungs. After leaving the right ventricle, it divides into right and left branches, each entering the corresponding lung alongside the primary bronchus. Inside the lungs, the branches of the pulmonary artery further divide into small vessels, eventually forming a network of capillaries closely associated with the alveoli. On the other hand, the bronchial artery originates from the descending thoracic aorta. It supplies arterial blood to the bronchi, connective tissue, lung stroma, visceral pleura, and pulmonary lymph nodes. The venous blood from these structures is drained by two bronchial veins on each side. The right bronchial veins drain into the azygous vein, while the left bronchial veins drain into the superior hemiazygos or left superior intercostal veins. However, the distal portion of the bronchial circulation drains directly into the tributaries of the pulmonary veins. Pulmonary blood flow. The lungs receive the entire volume of blood pumped out from the right ventricle. The amount of blood output per minute is the same for both the right and left ventricles, which is approximately 5 liters. Therefore, the lungs accommodate the same volume of blood as all other parts of the body combined. Regulation of pulmonary blood flow. Pulmonary blood flow is regulated by several factors. 1. Cardiac output. Pulmonary blood flow is directly proportional to cardiac output. Any factor that affects cardiac output will also impact pulmonary blood flow. 2. Vascular resistance. Pulmonary blood flow is inversely proportional to pulmonary vascular resistance. The pulmonary vascular resistance is lower compared to the resistance in the systemic circulation. Different phases of respiration can alter pulmonary vascular resistance. 3. Nervous factors. While experimental stimulation of sympathetic nerves increases pulmonary vascular resistance through vasoconstriction, it is unclear whether autonomic nerves play a significant role in regulating blood flow to the lungs under physiological conditions. 4. Chemical factors. Excess carbon dioxide or lack of oxygen can cause vasoconstriction in the pulmonary blood vessels. The exact cause of pulmonary vasoconstriction due to hypoxia is unknown, but it has implications, as hypoxic areas of the lungs experience capillary constriction. 5. Gravity and hydrostatic pressure. Similar to the effect of gravitational force on blood pressure in the body, the pressure in the pulmonary blood vessels varies in different parts of the lungs. This variation contributes to different zones of blood flow and ventilation perfusion ratios. The pulmonary vascular pressure varies across different regions of the lungs, leading to distinct zones. Zone 1 apical portion. This area is characterized by zero blood flow. Gaseous exchange does not occur in this zone, rendering it a part of the physiological dead space. Although it is ventilated, it is not perfused. Zone 2 mid-portion. In the mid-portion of the lungs, the pressure in the alveoli is lower than the pulmonary systolic pressure but higher than the pulmonary diastolic pressure. As a result, blood flow to the alveoli increases during systole and decreases during diastole. This zone is referred to as the area of intermittent flow, and the ventilation perfusion ratio remains normal. Zone 3 lower portion. In the lower portion of the lungs, the pulmonary arterial pressure exceeds the alveolar pressure during both systole and diastole. Consequently, blood flow in this zone is continuous. It is known as the area of continuous blood flow, and the ventilation perfusion ratio decreases due to the increased blood flow. Clinical applications of the ventilation perfusion ratio, V/Q, are as follows. In conditions like pulmonary embolism, where there is a lack of blood flow and perfusion, the V/Q ratio becomes infinity. Conversely, in situations such as foreign body obstruction, where there is no ventilation but intact perfusion, the V/Q ratio becomes 0. These measurements help diagnose and assess lung conditions.